Okay, so health education to me is the process of promoting and providing information to people on what they can do better to help the current health conditions and what steps those people can take to prevent some health conditions from developing in the future. Health education to me is also just raising awareness and basically having the public having like a general cohesive understanding of certain medical conditions, and also to break down stigmas of some medical conditions and diseases that are out there. And basically by doing this and breaking down stigmas, we will set a better healthy like environment in the medical field, and also how to live a better healthy lifestyle. Why I chose to be a health studies major is because it's in the healthcare realm. I've always wanted to work in healthcare in some sort. I just wasn't sure how. I think part of that had to do with my parents both working in hospitals and working with people for the general public. And I was a kinesiology major before. I originally planned to do physical therapy, but I quickly realized after my first semester at TWU that wasn't the fit for me. So health studies is still going to give me the opportunities to work in the healthcare field and, make a difference in the community. With this degree, I do want to be a public health educator. With being a public health educator, some areas I would focus on are racism and discrimination in the healthcare field and sickle cell anemia. So with racism and discrimination in the healthcare field, that's a big issue going on right now, especially in African American women, specifically during childbirth. The amount of African American women that are dying from complications or dying during childbirth is an alarming rate compared to other races. And I believe part of that is the fact that there is still a racism and discrimination issue when it comes to healthcare providers and African Americans. Also, African Americans are one of the populations that I would prefer to work with. And with sickle cell anemia, I feel part of it is not as known as it should be, especially since it's a disease that you're born with and you basically have it for the rest of your life. And my goal would be to raise awareness about the deadly disease and how others can support those with sickle cell anemia. And this disease also does target the African American community more so than others. But with sickle cell, it would be just the disease in itself. Also with sickle cell, I would want to focus on advocacy for people, for sickle cell patients, especially lower class individuals who may not have the means to access some treatments like others could. So I'd like to raise funds to get them the services they need to be able to deal and get the treatment so they can live a healthy life with sickle cell anemia. Like I mentioned before, the population I would prefer to work with is African Americans, especially when it comes to discrimination in the workplace. But I would want to work with the young adult age, preferably people in lower socioeconomic statuses. I picked this age because the steps that they take during this 16 to 25 age realm, the actions will affect them later on in life. So if they don't have the education about some things, they could be making some decisions that would later on affect them. And if they get the resources they need, they may be able to prevent some health conditions later on in life, which will, down the line, lead to a better, a whole group, community-wise in health. Some of the settings that I would like to work in, basically lower income people, because I feel like they need to have the same knowledge and resources as wealthy people do so they can live prosperous lives. And some conditions is just not taught, and if you don't know how to protect yourself against certain diseases or what steps you can take to lower your chances of developing down the line some health conditions. And that is all I have and why health education is important.